When I was young, you expected to live 70 years till you're 70. Average life expectancy has gone up by about 20 years now, so we're looking at 90. And we know that with increasing age, you've got increasing likelihood of episodes of ill health and being in hospital. What I'm concerned about as a chief exec of a hospital is that care of older people is no longer a single specialty in a couple of wards as it was when I was a student nurse. It applies to all wards across the hospital. And caring for older people requires special skills, it's complex, and we need to get it right. And that's why I was interested in taking part in this commission. Of course, complex care costs money. We have more older people living longer, and that's why I think we've got such out of kilter with the funding around the NHS.
Well, I spend my working life as a frontline hospital doctor, both at the acute medical unit in the emergency department and then on the wards and right the way through to discharge. We know across the whole of England that urgent activity is rising, admission rates are rising despite fewer beds. Many of the older people who present themselves to hospital have got problems that could have been solved or supported earlier before they deteriorated if only the right supports were in place. A lot of them really are very sick when they present. And the issue isn't so much that we're admitting too many people, because we do everything we can to get them back home. It's that they stay in hospital too long. We just don't have the capacity in social care or intermediate care or community rehabilitation to get them out sooner. We sometimes make them worse by letting them become immobile, by moving them around too much, by letting them develop complications of hospitalisation. Some of it is just because we as professionals could work a lot smarter in the way we look after these people. First thing is better primary care support, better rapid response support closer to home so that people don't end up in the emergency department in the first place. The second thing is when they do arrive, they should be seen by expert decision makers quickly with the ability to turn people around once they're stable and get them back home. But the third thing is at the back door of the hospital, we need far more investment in rehabilitation and support in people's own homes so they don't get stuck in acute hospital beds.
I think the challenge for us in this country is that if you look at the data over the last 50 to 60 years, healthcare costs have gone up by around 4%, in fact just over. But national income or GDP has risen by 2.5%, and that trend really shows no sign of slowing. It's predominantly because of scientific advance. And obviously, as we know, a lot of costs lie at the end of life and are often borne in the hospital sector. And I don't really see anything changing in that regard over the next 50, 100 years. So actually I think expectations are potentially out of balance in terms of what we want to pay or expect to pay. And the only way of working through that is to have the debate with the public, for the public to engage more fully in understanding these issues. Because if we want a society with sustainable healthcare, then it's in all of our interests to address it. Costs will continue to rise, and we need to explore whether there are things that we do for ourselves or whether there's an appetite in the public to pay more. And I think that debate is really important, and it's something that politicians can lead on.